Welcome back. You made it to the last few sessions. Congratulations. Panelists, can we give them a whatever?
Right. Good.
This is an achievement to have packed your brain, your mind, your heart with all this information. And we know that you will still have more questions. So please note, just like Leah said, that this is a 6-week course. You had homework before. This is the kind of bulk of the bell curve, if you will, but we still have 4 more weeks of wonderful access to the minds and experiences here on this panel. So please stay tuned with Facebook. So let's get started with our question and answer session. And again, a reminder to my fellow panelists, we are speed dating so we can get through as many of these questions as possible, okay? All right, so something on top of mind of our attendees is, what is the best risk score to calculate the 10-year risk of a CV event? Which ones, if you can just in a short phrase say which is the one you use?
I use the Reynolds score.
Okay, great. Yusuf?
AMA, the one the AMA recommends, the cohort.
Okay, great. Michael?
Both, depending on the risks.
Okay, and I tend to use Reynolds, but I think it's good to use something as a way to just keep yourself honest with the standard of care and also just help patients get evidence-based understanding of their true risk. Okay, next question, berberine. We get this often every single year. We've recommended berberine as an anti-inflammatory and it works through modulating the gut microbiota, but is there any concern for taking it long-term? Anybody want to raise their hand and answer that one? Okay, Mimi.
I don't think we know the answer. I think if we're giving berberine to lower blood sugar or giving it to lower cholesterol, then we should be making sure it's doing what we intend for it to do by reassessing and stopping if it doesn't seem to be effective. It's an antibiotic, berberine. It's one of nature's antibiotics, so it can impact the microbiome.
Yeah, I would say we don't have long-term data as well too. And sometimes I, just like probiotics, I might move them around. I might do that with berberine. We don't know either way. So again, Mimi's wise advice is pay attention to the patient. Make sure you're tracking and seeing if it's making a difference or if it's time to switch it up. Okay, great. What are the most effective supplements to optimize Lp(a)? You know, people might have they said, I have a list of supplements, but any new researched ones? Well, I don't know what's on your list and I don't know what you consider new. So let's just ask the panelists, what are the top 3 supplements that you use? Or maybe I'll say top 3 strategies that you use. It doesn't always have to be a supplement. Top 3 strategies you use when someone has an elevated Lp(a). Okay, let's start with Michael.
I look down these. I always make sure people's essential fats are adequate, and I also make sure that their B vitamins are adequate.
Okay, great. Yusuf?
NAC, niacin, and make sure that look for other factors that may indicate that they're hypercoagulable. So if they have high fibrinogen, since it does cause Lp(a) does cause a hypercoagulable state, then I just optimize that, work on earthing, work on exercise. And to me, it's just a marker of we need to be more aggressive about your numbers.
Yep.
Yep. Maybe anything else to add on top of that?
One of the hardest things to treat is Lp(a). Don't get disappointed. You can do the old Linus Pauling regimen of high dose vitamin C, proline, lysine. I see very few people respond to that. Niacin, definitely in some people. And of course, for your secondary prevention, you really should be thinking about a PCSK9 inhibitor. Okay,
wonderful. What I would add to that is kind of just to keep it simple part to Yusuf's thing that, you know, Lp(a) being something that affects flow dynamics and is associated with hypercoagulability. I like to try to look for sources of inflammation and get rid of them and then optimize anti-inflammatory, just like Michael talks about with fish oil. So whatever you can do to leverage the inflammation axis, the less power Lp(a) has over the entire system.
Look in the mouth.
What's that?
Look in the mouth.
Look in the mouth. Tongue depressor. Bite down. Okay. Actually, there's a question about that. Oral microbiome. How do we optimize oral health other than usual dental care? Are there prebiotic foods for this? Or let's just kind of keep it broad. How do you optimize oral health? Or how do you counsel on that? Okay, let's start with you, Michael.
I often check, in the office, we check the pH of saliva, and then we have people do a probiotic swish and swallow. We look at what medications decrease salivary production, and if they have a dry feeling mouth, because your saliva really helps you modulate the pH of your mouth and thus change the microflora. It changes the whole axis. So check the pH, consider a probiotic swish and swallow, see if they have any abnormal tongue coating on their tongue. It's a good place to start.
Awesome. And for those of you who've done AFMCP, refer back to Michael Stone's, whether Michael Stone gave it or somebody else gave it, the nutrition physical exam, the nutrition-oriented physical exam for other things that you can learn about the mouth, the oral microbiome. So anything else that Mimi or Yusuf wants to add to that?
Xylitol gum, and buy yourself a miswac, M-I-S-W-A-C. I think it's called a pila tree in Middle East and India and Africa. That's how they brush their teeth before. And there's you can find YouTube videos on how to use it, and you just run around and you just keep brushing your teeth all day with it. It's the coolest thing. Miswac. Everybody should get one. And once you buy one on Amazon, I'd love to see your picture on the Facebook group with your miswac.
Okay, I'll get one this week. Thank you.
All right, I'll send you one.
It's going to be our next group selfie.
Yeah.
Okay, great. You know, whenever you have oral microbiome issues, I would also look for food sensitivities, because many times acid reflux is coming up and changing the oral microbiome. So look a little bit lower in the GI tract and the upper GI tract to see if it's coming up and causing issues in the oral microbiome.
Good.
Okay, let's see. For any recommended approaches to treat sleep apnea other than CPAP, such as oropharyngeal exercises, my answer to that is weight loss, fat loss to be more specific, right? Like, as I said, every 25 pounds, at least that's the last I understood, every 25 pounds, there's a recalibration. And so if they lose a critical amount of fat mass, perhaps that changes the anatomy enough that they don't have the obstructive sleep apnea, I should say.
Insulin resistance causes your tongue to get fatter.
And why is that? Because it is following the same pathophysiology that I mentioned about the liver and the muscle. You get fat deposition and you get sarcopenia. So you get a fat deposited tongue that then has more propensity to roll back into the airway.
Correct.
Yep. Awesome. Like Michael Stone is the physical exam. What would we call him? Beast. Okay. You never usually use the word beast.
Well,
You're so nice.
I guess I'll take that. Okay, good. Thanks.
Yeah.
Gilpa, there's a very important distinction here between obstructive sleep apnea, between craniofacial deformities causing sleep apnea, that can be more than just a fat tongue, and central sleep apnea. And I just want this group to be ahead of the curve and know there's a new boy on the block called a Vivos device, which uses a mouthpiece with stem cell therapy that realigns the entire airway and is actually a treatment for mild to moderate sleep apnea. So this will be a game changer, and it's just coming out.
So can you spell that, Mimi?
It's V as in victory, I-V-O-S, Vivos, and it is now approved for mild to moderate sleep apnea. It's a dental device, and it restructures the airway to open the oral airway, and nothing has to be put in the body. You don't have to wear a mask. So I think this is really one of those game-changing technologies.
Awesome. You heard it here first. The Miswac and the Vivos.
I'd like to add, there is a connection between sleep apnea and reflux, and also a connection between sleep apnea and insomnia. And one of the missing links that links them together is a body deficiency in melatonin. Melatonin strengthens the lower esophageal sphincter. So there's two things that, apart from weight loss and exercise and whatnot, that you can give it a trial of and recheck them, is stop eating after 6 o'clock, just liquids after that, and take melatonin 3 to 5 milligrams at night with an activated B vitamin. Give it about a month and recheck it, and you'll be surprised some of your sleep apnea patients don't have sleep apnea anymore.
Awesome. What about blue light blockers? Does that help, or is that not enough? You have to supplement.
Yeah, so blue light blockers are going to increase the amount of, they're going to make your brain release melatonin, but it's not going to increase the production of melatonin. So to increase your production of melatonin, you need to make sure that you are on a good protein, and you need to make sure that you have enough stomach acid. That tryptophan needs to be methylated to become 5-HTP. The 5-HTP becomes serotonin. And then your serotonin has to become melatonin, and you need SAMe for that. But you could start by giving a little melatonin and then working on all that stuff later, and exercise.
Neurotransmitter pathways, people, it all comes full circle. Like I noticed we're talking about the gut, we're talking about the brain. I mean, the heart is so much more than just the heart. A lot of things affected in the family. Okay, anything else to say about that subject?
Breath work is very important.
Breath work.
I've had people cure their sleep apnea playing instruments like the didgeridoo, and I strongly recommend to my patients the book Breath by Nestor. It's a life-changing book for many people.
Okay, wonderful. Yeah, I mean, again, ancient cultures have been suggesting this for a long period of time. I can speak to the one that I know, which is the Indian one, but pranayam is just an ancient set of breathwork exercises, all different kinds of breath work to be able to improve that aspect of function. Okay, let's move on. For PCOS patients, do you recommend treating with oral contraceptive pills, like a hormonal Band-Aid, while trying to correct the metabolic abnormalities, or do you just give metformin, or both, or neither? That was directed at me. I'll tell you what I tend to do. I first have a conversation with them about their fertility planning. Like, what is their family planning? Are they trying to have a baby? Are they, nope, I just want to get biologically more balanced? So that's the first thing I would say. Now, of course, if they're trying to get pregnant, I generally start with what I call that detox elimination diet. I like to control, I'll delete certain things, because many times when you fix the gut, improve the liver, work on the HPA axis, there's just many mechanisms that start working. Now, during that time, I don't put people on birth control pills. I do recommend barrier protection, because we don't, like we mentioned here, want to do a detox into a baby. And many times when I don't know about you all, but when you normalize someone's gut, reduce inflammation, take out detoxification, women who don't get pregnant easily all of a sudden become quite reproductive. So you've got to give them some contraception in the form of barrier is what I would use. Abstinence doesn't seem to sell very well. So I rarely will put people on oral contraceptive pills, specifically PCOS. Now, that's how I generally start. And I like to bring in, especially for my patients who tend to have strong HPA axis, I really like to refer out to someone who does acupuncture. Sometimes they get on Chinese herbs as well to be able to parallel some of the things that I'm working on. So that's kind of how I start out. And then, of course, the lifestyle pyramid, the lifestyle base, with exercise, nutrition, sleep, stress management. So that's how I do it. Anybody else have any other ideas or more ideas?
Nothing to add.
That's it.
Yeah, so PCOS is associated with poor detoxification pathways. If you look at BPA that was found in plastics, still found in some plastics, I guess, but what they found is people with PCOS had a higher chance of getting ovarian cancer when they were exposed to BPA. So I really want to work on those phase 2 detoxification pathways and really get those insulin levels down. So they have to go lower carb, higher vegetable intake, really up the fiber. And it's amazing how they get better from that. And intermittent fasting, there was some research on intermittent fasting, how it's very helpful with PCOS.
Wonderful. So along that same axis, a question has been raised. Besides a hemoglobin A1C, fasting glucose, and fasting insulin, what are other labs for early detection of insulin resistance? What are good physical exams for insulin resistance findings? So I'm just going to say what I said in my lecture and then see what pearls our panelists have. So remember that you'll get sometimes a high triglyceride shift. Do not wait for your fasting glucose to be 100. I look for optimal at around 70 to 85. And as they get ooching up towards 99, I'm thinking I need to be looking. I don't wait for the fasting, like the range for fasting insulin is like 25. That's way too high. I look again, 5 to 7 is my range in the bottom quartile. And then if they're ooching up, that's to me looking out for more insulin resistance. So we talked about triglycerides, their LDL particle number and size. If you see normal cholesterol, but you see that their LDL particles are more small, dense, and the number is higher, that could be a sign that they have insulin resistance. Let's see. Those are kind of the go-to ones that I'm coming to the top of, that are come to the top of my head. But if you go to that lecture, Fire in the Hole, it'll show you some of the other things that you could be looking about. Looking at the other comorbidities is a way to backtrack and say, oh, this person has fatty liver, has osteoporosis, you know, also seems to have visceral adiposity. Those might be things that you look back and say, what does that have in common? Insulin resistance. Yeah, Mimi.
Yeah, well, you can sometimes see, and I think Michael's talked about this, acanthosis nigrans on the skin. You can see skin changes. LFT abnormalities are frequently a heads up to fatty liver. And if you do a BIA in the office, right there you have the body fat percentage, and you're going to find those skinny fat people who are actually insulin resistant.
Right, especially the ethnicity specific cutoffs. You want to look, you know, especially if they're of the Asian or Hispanic racial origins, there's just higher associations because it takes less visceral fat in these groups to trigger the insulin resistance, if you will. Yusuf, did you have something to say too? Yeah.
Yeah, so C-peptide, I check C-peptide in my patients, and in the chat box real quick, ask me which lab I use so that I can tell you for CME purposes. So while I'm doing that, so insulin comes out as proinsulin, which is insulin and C-peptide. C-peptide, we actually think protects your neurons, and it has a longer half-life. So what ends up happening is your insulin could look normal, but your C-peptide is high. And, oh, you want to know which lab? Okay. Quest Laboratories actually has a insulin resistance score through their Cardio IQ and also through Cleveland Heart, their Cleveland Heart Lab. And that insulin resistance score will give you an insulin, a C-peptide, but also a score based on that. That's a validated test that can really detect that insulin resistance really early. So we try to get that on anybody that we're worried about insulin resistance.
Okay, awesome.
So what I would do is anytime I start seeing a rise in HSCRP, I assume insulin resistance. If I think insulin resistance, I know that making sure that their magnesium is adequate just by adding 400 milligrams of magnesium orally to an adult improves the insulin receptor activity. Then how often do your patients come in and say, wow, I'm getting these skin tags in my axillary folds? That is one of the first places that you see skin tags form. Anytime you see skin tags, you think insulin resistance because of the effect of glucose itself on the epidermal growth factor.
Very good. And that just alerted me to vitamin D deficiencies.
Yep.
Vitamin D deficiency will increase risks for insulin resistance. So replacing vitamin D, generally, I like to get it at least to 50. I like to get it up to 80. And that really helps insulin sensitivity. And just as a pearl, like I live in Florida and I practice just 5 miles south of the nudist capital of the world. So I take care of nudists, and you might assume that nudists with more skin exposure in Florida would have normal or healthy vitamin D. It is an for many reasons, whether it's they're wearing sunblock or they're wearing clothing when they go out to the grocery store, or they like to stay inside when it's hot. You know, people are, they're like glorified cave dwellers these days. So even in Florida with nudists, I would say that 80% of my patients are vitamin D deficient, generally 30 and under. Would you all say that?
Definitely.
Do they wear your clothes when they come to see you?
They do.
Okay.
They do.
So, and I think that
very respectful.
You think about vitamin D insufficiency, no matter what the age. If somebody's not taking adequacy in vitamin D and their levels aren't adequate, even during pregnancy, their child would be born suboptimal. If they're breastfeeding and the mother's not taking supplemental vitamin D, their child is frequently low. 96 for the first nearly 2,000 patients we checked before we started really augmenting a lot of vitamin D. We had 96% of our patients at our latitude that were suboptimal, and 10% frankly deficient, and 30% very insufficient. So yeah, it's always right up there for almost any part of the matrix.
Yeah. That's why it's one of my almost always replacements, along with magnesium. I find that many people are magnesium deficient, B vitamin deficient, EPA, DHA deficient. Yeah, I think those are kind of the common ones. Okay, I have a lot of patients that eat well, sleep well, exercise, but they are very stressed and they can't lose weight. How can I help them? So that might be many intense personalities. I don't know about you all, but sometimes you get those real like lifestyle, oh gosh, they're just so intense about every rule. They follow it to the T, and that intensity is what I think is actually keeping them from being able to lose weight. So for me, what the question was directed towards me, what do I do? Well, I actually try to get them to think beyond their physical body and just really, I try to engage with them on what's really going on. Why is this so important to you to lose weight? And why are you living and dying by this weight? Now, of course, there's a physiological benefit, but what's in it for you? And then I try to, if that kind of conversation doesn't work and they can't kind of create a new relationship with their weight loss goals, then sometimes I will use L-theanine or GABA or 5-HTP or tryptophan strategically to try to create some neuroinhibition, just to calm the brain so that they're not as intense. Sometimes I will use adaptogens. It just kind of depends on what they're open to be able to just create the HPA axis to calm down. Of course, I love deep breathing techniques, mindfulness-based techniques, meditation, prayer. I just have to meet them where they're at to kind of call out the intensity that they're coming to life with, and just showing that that's not balanced, because they eat well, sleep well, and exercise, but they do it in this intense fashion. And that's how I know it's not a healthy relationship with lifestyle. How about you all? Mimi.
I think you say they sleep well, but I think it's important if someone's very intense to do an adrenal stress index. I like to see a salivary cortisol over 24 hours, and that helps me guide adaptogens. If it's high in the evening, again, sleep apnea is still in the back of my mind. If somebody wakes up with a high morning cortisol, I think it's also important for us to set reasonable expectations and educate people around weight loss. I mean, when we do a BIA and we determine a basal metabolic rate and an energy expenditure, then we decide, okay, a 10% weight loss over 6 months maybe for you is healthy. This is how we achieve it. And really explaining to people the science behind it can be very helpful. It's not just as simple as, oh, gee, I want to lose 50 pounds in 3 weeks. No, that's not happening. Right. And then there's orthorexia. I want to bring that up because we create orthorexia when we tell people, don't eat this, don't do that, stay away from gluten, stay away from dairy. And sometimes it becomes too much.
Mm-hmm. Be careful who you're saying your recommendations to. If they have a propensity towards intensity, like create balance in the conversation. Yeah, wonderful. Okay, anybody else?
Yeah, I would say just remember that norepinephrine in its own right is toxic to a microbiome. So we can look at the HPA, we can look at the cortisol, 24-hour cortisol, see the diurnal variation, go through that. But what is the effect of that cortisol? What's driving that cortisol? Our norepinephrine will alter our microbiome. So in these really high-strung folks, you may have to look, especially after going to the GI, APM, you may look at the stool and you see how they've shifted. And that may be inhibiting their successful weight loss just by the norepinephrine driving and shifting of your microbiome.
It's all connected, people. We keep saying
So-
it. It's all connected. Brain,
So I'd like to
gut,
add
weight.
one more
Yes,
thing.
Yusuf.
All right. So whenever we're trying to track data, there's two types of measures. There's lead measures and lag measures.
Yep.
Lag measures are the measures that take time. You don't know until you know. So for example, if you're checking your weight in a month, you only know then if you lost the weight or you didn't. You either passed or failed. Whereas the lag measures are the things that you can look at every day. So the first step is to help alleviate their stress, give them some lifestyle things to do, and tell them not even worry about the weight. When they come back in, once they start, you build rapport and they start to listen to you and you feel like the need, then at some point there has to be some sort of a calorie recommendation. And they'll go and they'll exercise and they'll go out to, like, I don't know, they'll go out to like the springs and they'll go to the nudist beach and whatever the heck else they're doing to try and relax and lose the fat. But if you can get them to remember the one thing, which is calories, and they make sure that they're hitting their calories, then yes, you get the vitamins. Yes, you make sure they're getting their vegetables and it's healthy. But their number one goal for the day and the thing that they're tracking every day, did you hit the calorie recommendation or not? And we have BIA that can estimate your basal metabolic rate, but we also do an RMR at the office so we can tell for sure how much are they really burning. But I think that sometimes you got to get technical. Sometimes you got to get technical and say, this is the one thing I need you to follow.
Yeah, data is definitely important. So we're just going to be, for the sake of time, what I believe we're all saying is, like, listen, science is important. And sometimes you got to get technical with the data, use the toolkit, use the tools that you have clinically. But one of the best kind of analogies that someone taught me to use, which I really like, is there's this thing called victory gardens after World War II. And these, people would plant these seeds and they're, looking to kind of create a regrowth of just life after this war. And there's a story of a boy who plants these seeds and then he's like doing everything he's supposed to these seeds. And then a week later, he's just really depressed that nothing is showing as a visible sign. And so he tries to do a little bit more. And 2 weeks later, he's like, still nothing. And so he digs up the seeds in order to see, like, is it working? And he sees like, oh my gosh, there's a sapling that was just about to come up. And he goes in and he shows his mother, like, mom, look, these seeds they're turning into saplings. And then the mom says, yes, but in your desire to have to know that it's working, you just destroyed the ability of that to be able to take hold. So I think it's a beautiful way to say to someone, like, listen, I know you're looking for proof, but sometimes you just got to put your faith in the actions that you're taking, whether they're nutrition, exercise, stress management, sleep, and let's work on that because that's the part that is controllable. And we'll use metrics that, do not destroy the beautiful sapling that's going to show up at some point because you're just doing the right things, if I may. So thank you, panelists. This was an awesome, again, bit of pearl dump that just happened here. We are going to now transition to our reflections and closing. Thank you again for always being so full of wisdom and grace to be able to help all of us learn. I learned so much in this Q&A. Okay, give me a second. Okay, crew, 685 of you who have come along this journey to feed that sapling. And maybe it emerged this weekend that you have some new ideas, some new intentions, some new tools that our team has provided you. Now, I do want to say one thing on the side. It's my 23rd wedding anniversary today, and my husband and I were, just hanging out here in between the breaks. And I asked him, hey, hun, do you have any advice for these 685 people, you know, because it's our anniversary and I'd love for you to contribute because you've been along this ride for me, been on this ride with me for a long time, and you have insights that are outside of what I know because I'm so in it sometimes that I don't see things that you do. So you know what he said to me? He goes, please tell those 685 people that when they leave this conference to be gentle on their family and do not make them become these guinea pigs. You got to take it slow with your family and friends. So he says, listen, you will likely have taught them a lot of stuff. Just tell them that they've got to be nice to their family and just engage them and partner with them, and do not like stress them out over everything you just learned, which I thought was hilarious because I don't know about you. When I learn something new at a conference, my staff and my family is afraid. They just don't know what I'm about to make them go do or experiment with. So I thought that was sage advice, that all this information that you are receiving still has to be delivered in a respectful way that is partnering with the people. And guess what? Your family is people too. So having said that, one of the other themes that we want to, of course, share that Mimi introduced is gratitude. And it would be absolutely inappropriate if we did not have gratitude for the many people who are behind the scenes putting this program together, this crew at IFM, the amazing digital team that has come together to really create such a wonderful experience for all of us to be able to partner together. So I just want to, everybody clap, woo, reactions. Thank you very much. I can't even tell if you see me, but I am waving my hands in the air like I just don't care. Okay. Now, the other thing that was a theme is ecosystems, right? Whether we're talking about the ecosystem around the artery, around the circulatory system, the body, the microbiome, but also the ecosystem of our community. And what we'd love to cultivate is resiliency, the secrets of resiliency that you have, that you've been using. So we're again reminding you to reach out with your, best and greatest tools and suggestions and secrets to resiliency. So just join our 2021 Facebook page, the Cardiometabolic APM, and please share. And we look to create a document that's going to compile 101 of the best ways to cultivate resiliency. And one of the other things that Mimi has also kind of touched on is it's not only in the receiving that you feel resilient, it's much in the giving. So what we would love to do is take these 101 ways to be resilient and share it with the community beyond this module, from all of us to the other modules, to the other functional medicine providers and beyond, so that they have access to the wisdom of this crew. So thanks for remaining resilient together with us and sharing that. So in terms of resiliency, goodness, is there a time in the history of this planet where resiliency is needed? At least in the one that we know about here, resiliency is so desperately needed as an ingredient for well-being, like B-E-B, well-being. And as faculty and educators, we'd love to be able to share with you what we use as well as tools for resiliency. So for me, one of the best ways that I can remain in touch with what grounds me and what allows me to move forward is to remember that I have a set of filtering glasses on me at all times. So what do I mean by that? I look at the world through my preconceived notions. I look at the world actually through my past. I wound up becoming a certain way because I'm looking at the world like, oh, this person's likely not going to do well with this recommendation, or, oh, this person, I don't even know if I have time, or insurance is or whatever. I look at the world from the lens of my past. And what it does is it limits me. And sometimes it disheartens me. And sometimes it makes me really happy about things. But what I try to do when I find that the world does not appear the way that I want it to be is I actively remove my lens and then I say, okay, now what do I see? And when I take that cynicism and resignation lens away, or the lens of defeat or not trying, or I'm too tired or I'm too busy lens, what opens up for me is so much more gratitude and possibility. I see the world as so much more possibility when I take away all these lenses that I know limit what I think is possible with a patient, with a community, with my life. And that's what I use to keep resilient in these times and all times, is kind of be aware of what stops you and just very kindly remove it and see the world again, and then act, and then let go of whatever happens. That's all we can do, is act. And then we let the results be what they are, and then we act again. So if I can give you that piece of advice on resiliency, I would be very honored that I even had that chance to share this with you. So let's see who, if it's okay, we're going to go to a panel shot of all of our presenters. Okay, sorry about that lag. So here we are with our amazing panel of educators. And first, I want to also thank this entire team for giving it all their heart this weekend. It took a little extra something to not be able to see you and be with you. It really did take something different for us to generate the energy, the love, the community, the inspiration. So thank you so much for holding that space with me, fellow educators. Thank you for continuing to honor what we always want to deliver to our community. So Michael, since you are closest to me on the Brady Bunch grid, would you be able to share how you stay resilient in these times and in just life?
No, I'd be happy to. And I would just say this has been a very difficult year. There's been, how do you balance fear? How do you balance expectation? How do you see, as you suggested, the world around you? And so how do you let something be and walk around it? How do you let it go, and how do you let in gratitude? And the tool that helps me truly every morning in the transition between night and day is trying to quiet the mind. And for me, we have animals, so I have to let the animals out. I have to take advantage of my cell phone camera. And by being able to see through the lens of the cell phone camera, I see beauty, I see contrast. It allows me to let in 20 seconds of gratitude, 30 seconds of gratitude, and that helps me make new connections. It helps me see the world that doesn't see a pandemic, that doesn't have the fear, that doesn't have the worry, and that allows me to offer grace to myself, to family, to the patients that we see every day that are struggling with those fears, anxieties, and the disconnection, and allows me to connect. And so I find that this cell phone camera, especially in the last year and a half, has become my gratitude journal. And it helps really ground me to see the world differently.
Beautiful. Well, using your cell phone camera while you're barefoot on the earth.
It works.
Love it. Double duty. Okay, thank you. Yeah, pets. Wonderful, wonderful grounders. Okay, Yusuf.
So I just want to say, every year at this time, I start to feel sad towards the end. And I wasn't sure if it would be the same because we're doing this virtually, but it's the same feeling. So in that chat box, are you feeling the same thing? I'm really going to miss you all. fellow presenters and attendees, and hopefully we'll all keep in touch. I'd like to share something that I feel like has really helped me during these difficult times and before these difficult times. It's something that has not only, it's something that not only I feel like helps me, but helps my patients and friends of mine that have taken it up. And that's where I'd like to invite you to look up the poem, The Guest House by Rumi. And if you take a look at the poem, what you'll see it's talking about embracing your emotions, whether it's a good emotion or what's considered a bad emotion, just really embracing it and not running away from it and just taking the time to feel. So what my advice would be, or what my invitation would be, is know what your symptoms are of being triggered. What do I mean? Are you getting irritable? For me, sometimes I'm joking too much. Like I just don't let anything happen. I'm just joking all the time. Are you being highly critical of others or highly critical of yourself? Are you finding that you're getting easily insulted when you really sit back, you weren't being insulted? Those are all signs that your heart needs to start feeling those emotions. You're running from those emotions. You're suppressing those emotions. And what I'd invite you to do is then just stop and just feel it. And just feel it. Is it in your heart? Is it in your abdomen? Wherever it's at, feel it and remind yourself. I remind myself, I know that it seems like it sucks, it always will suck. It's always sucked, but the reality is it doesn't always suck. This is going to pass. And then I kind of acknowledge what made me get into that state. Was it overwhelm? Was it, am I afraid? What the feeling is. And then I shut my brain off logically completely, and I just feel the feeling, and I just hold it, and I breathe. And I stay there as long as I need to. And then I move on with my day, not forcing anything, just allowing it in, allowing it to come in, not being afraid of it. And then I go about my day, and what you'll find is that without even thinking about it, you'll start to feel better and better. And like being true to the poem. So make sure you look up the poem. What ends up happening is that you end up feeling better than before you even felt triggered. So if that is helpful, then I am honored. I'm honored to have spent this time with you. And like I said, we'll keep this connection. I'll see you all in the spiritual realm. I'm going there in about 15 minutes.
Oh,
We're
thank you.
forever attached, aren't we? We are forever attached, at least via Zoom, hopefully something bigger than Zoom that connects us. Okay, I really appreciate what we're all saying is just to be with the suchness of things, right? Like be with it, not like it's wrong or you have to deal with it, but just be with it because there's beauty.